So let's get started today with a new theory and with a new topic. And the topic is the continuation of general physiology. So I welcome you all on Dr. Reena's Physiology. This is the Telegram group, Physiology Snaps to Success, where you will get the notes of whatever topics I take on. The topic today will be active transport. You know that active is active because it is uphill. That means it is against concentration gradient and it is using energy, and it is of two types, primary active and secondary active. But today we are going to focus only on primary active, and we will be taking or learning the primary active transport through sodium potassium ATPase pump. So let's do a brainstorming with important case-based MCQ. A 40-year-old man presents to the primary care physician with a 2 months history of intermittent upper abdominal pain, and pain is especially shortly after eating. He is referred to a specialist. He went for a gastrointestinal endoscopy, and then it revealed a peptic ulcer for which he was prescribed omeprazole, which is a gastric proton pump inhibitor. And the last line is the simple physiology. What type of cell membrane transport is inhibited by this medication? Options: facilitated diffusion, osmosis, primary or a secondary active transport, and simple diffusion. So let's answer this after we complete the theory. Now, as I told you that primary active transport is primary because it is using energy directly by breakdown of energy, that is directly by causing hydrolysis of ATP. So that is the criteria that why primary is primary, because it is causing a direct breakdown of energy, which is not a feature of secondary, though it is active. The most common example, rather the only example which we remember, is sodium potassium pump. But remember the calcium pump, which is present in the muscle cells, and you remember it via SERCA, the sarcoplasmic endoplasmic reticulum calcium ATPase pump that throws the calcium back into the sarcoplasmic reticulum, which is present in the muscle cells, is primary active transport. Hydrogen pump that is present in the parietal cells of stomach, responsible for the secretion of HCl. The intercalated cells of kidney, which are secreting again the H plus ions into urine, are another important examples of primary active transport. So today we will focus on sodium potassium pump, which comes as an image based question, MCQ, as well as a very important short note. So this is a heterogeneous heterodimer, right? It is a heterogeneous heterodimer. That means it is made up of two subunits, alpha and beta. Beta is only having sites for glycosylation, okay, only having sites for glycosylation, whereas it is the alpha subunit, which is actually the active one, which is having extracellular sites and intracellular sites for binding of different constituents. On the side which is facing the ICF, there is sodium binding site, ATP binding site, and phosphorylation site. And on the outside, you have got site for binding of potassium and couabane. This couabane is actually a cardiac glycoside. Okay, it is a cardiac glycoside. For example, digitalis. You will learn in pharmacology, it has got a positive inotropic effect. That means it increases the force of contraction of heart, right? Now, so alpha subunit being larger, molecular weight is 1 lakh, and beta subunit having molecular weight 55,000. Alpha subunit on the side of the ICF has got ATP and phosphorylation site, and 3 sodium ions can bind. And on the surface, which is facing the ECF, 2 potassium ions can bind, and there is a covalent binding site, and therefore you say that the coupling ratio is 3:2, and this is again an important MCQ. 3:2 means 3 sodium outside and 2 potassium inside. Because you have to throw the sodium outside, the sodium binding site is inside, and because you have to take the potassium inside, the potassium binding site will be outside. Now, how is this pump functioning? What is the mechanism of this pump? Because I told you that it is going to break down energy. That means you require ATP. So this enzyme ATPase, which is present, it will get activated as soon as sodium and ATP will bind to their respective sites. मतलब जब सोडियम और एटीपी अपने साइट्स पर बाइंड हो जाएंगे जो अंदर है, this ATPase will get activated. Once it is activated, it is going to catalyze the hydrolysis of ATP into ADP, and this will liberate your high energy bond. So ultimately what do you want is energy. अब आप क्या करेंगे उस energy से? That energy will cause a conformational change in the structure of the carrier protein. So a conformational change will take place in the carrier protein. This will cause the sodium to get pumped back into the ECF. So you require high energy to bring about a conformational change in the carrier protein. Once this change occurs, the sodium will be thrown out or it will be pumped into the ECF. Remember, 3 sodium ions. इसके बाद जैसे ही सोडियम बाहर चला जाएगा, potassium will bind to its site which is present outside towards the ECF. जैसे ही पोटेशियम अपने साइट पर बाइंड हो जाएगा, देयर विल बी डीफॉस्फोरिलेशन ऑफ द अल्फा सब यूनिट, राइट. सो अभी हमको क्या करना है, हमको पोटेशियम को अंदर लेकर आना है. तो वो कैसे पॉसिबल होगा? पोटेशियम विल बाइंड टू द साइट ओवर द ECF which will cause dephosphorylation of the alpha subunit. इससे, इस dephosphorylation से what will happen? This will return the carrier protein back to its previous or the original conformation, which will then cause the release of potassium into the ICF. So पहले सोडियम और ATP बाइंड हो जाएंगे, ATPase को आप एक्टिवेट करेंगे, हाइड्रोलिसिस करेंगे ATP का, हाई एनर्जी बॉन्ड रिलीज करेंगे, चेंज इन द स्ट्रक्चर और द कॉन्फर्मेशन ऑफ द कैरियर प्रोटीन, सोडियम अंदर से बाहर चला जाएगा. जैसे सोडियम बाहर चला जाएगा, ECF के साइड्स पे पोटेशियम विल बाइंड, पोटेशियम विल कॉज द पोटेशियम का बाइंडिंग विल कॉज डीफॉस्फोरिलेशन ऑफ अल्फा सब यूनिट. दिस विल रिटर्न टू इट्स प्रीवियस कॉन्फर्मेशन और अभी पोटेशियम अंदर आ जाएगा. And 3 sodium outside and 2 potassium inside, therefore it has got a coupling ratio of 3:2. The very important functions are it controls the cell volume, because sodium is a very important ion that adds to the osmotic effect, and therefore if the sodium potassium pump fails, the sodium will accumulate inside the cells, और उससे क्या होगा? The cells will swell because of osmosis. Water will come inside, they will burst. Second is that this is contributing to your basal metabolic rate, that is BMR, because it is an energy consuming pump, isn't it? You are using energy in the form of ATP. So it is contributing to energy, and this is how the very important hormone, that is the thyroid hormone, and thyroid hormone is a calorigenic hormone, है ना? So it increases the activity of mitochondria and also increases the activity of the sodium potassium pump and increases your BMR. Finally, it is an electrogenic pump, because 3 sodium outside, 2 potassium inside. That means there is a net loss of 1 ion. There is a net loss of 1 positive ion, है ना? Because कम ions अंदर आ जा रहे हैं. This is what is creating to an electrical potential and is contributing to the resting membrane potential. How much? 4 millivolts, minus 4 millivolts of contribution to the RMP is by your sodium potassium pump. This pump is very important to re-establish the RMP after depolarization. So action potential के बाद अगर आप चाहते हैं कि next stimuli should give a response, it is very important that the resting membrane potential should be re-established, and that is brought about by sodium potassium pump. So another MCQ, the activity of the pump is increased by all except thyroxine, aldosterone, insulin or coapane. So all these 3 ABC, they increase the activity. Digitalis inhibits the pump, and by inhibiting this pump, you will understand that how the sodium potassium pump is linked to the calcium sodium exchanger which is present in the heart muscles, and how it increases the force of contraction by accumulating calcium. So digitalis inhibits this pump. So let's conclude with our MCQ. Definitely, whenever we speak of pump, it is going to be primary active transport. In this case, it is GIT. So the example was the hydrogen pump, which will decrease the secretion of HCl, and there will be a control in the acidic secretions and a relief to the pain that was induced by peptic ulcer. So thank you and a happy learning.